Hey, we are starting Friday Facts. Good morning, everyone. It's great to see folks joining us. We were talking right before we start recording. We are going into a big weekend. It is graduation weekend on a number of schools. I am wearing my different shades of blue, UNC and Duke. And then we were just talking, folks have high school graduations. It's Mother's Day weekend. So thank you all for joining us. And this is your Friday moment reminder to take care of yourselves while you're taking care of everyone else, whether even if it's around celebrations, that can be a very stressful time. I just want to say I'm so excited for the conversation. Karen Appert's going to lead us with our conversation with Dr. Megan Shepherd-Banigan, and we're going to continue on this caregiving theme. But a quick reminder, next Friday is our funky, fabulous, fun, that's a lot of F's, joint meeting with our colleagues with the North Carolina Coalition on Aging. Our meeting is still 11 to 1, though people are welcome to join at 10 if they want to get the Coalition on Aging's first part of their meeting. But from 11 to 12, we're going to have a different Zoom link because we're joining the Coalition on Aging's meeting. And we have great speakers coming to talk about both national and state family caregiver initiatives. So that's going to be wonderful. And then 12 to 1, you'll come right back onto this Zoom link so we can continue with our own updates and our breakout sessions. And with that, I'm turning it over to Karen.
Yay! Thank you, Heather. It's great to see everyone, and thank you for joining us. And as Heather said, we're kind of continuing a caregiver-focused month of May. And I am really pleased to be able to introduce our Friday Facts guest, Dr. Megan Shepherd-Banigan. Megan is an assistant professor in the Department of Population Health Sciences at Duke University School of Medicine. She's also a health research scientist in the Durham Center of Innovation to Accelerate Discovery and Practice Transformation. That's a mouthful. At the Durham Veterans Administration. She holds a doctorate in health services research from the University of Washington. In her work, Megan evaluates health system interventions and policies to improve care for adults with serious illness and their caregivers. And we are proud to say that Megan is a part of the caregiver and patient engagement work group of this coalition, which I helped to lead. And she's also part of the North Carolina Caregiving Collaborative. So we are really happy you're here, Megan, and we're excited to learn more about you and some of your background. That's one of the things I love about Friday Facts is we get to learn more about members. So I'm going to open it up to you and just ask you to tell us a little bit about your background and what experiences led you to the career path you took. And, as we mentioned earlier, you can go back as far as you want.
Great. Thanks so much, Karen. And thank you. Thank you for inviting me. It's really nice to see everybody. Definitely recognize some faces and names and not others, but it's really nice to be here with you. Um, so, I think whenever you kind of look back on a career, it seems so streamlined, but then the process is so circuitous. Um, when I grew up overseas and always thought I was going to be a diplomat. And so I did international studies in undergrad, and then I got to do an internship with the Carter Center looking at the impact of war on public health. And that was sort of a kind of an introduction into the world of public health. I became really interested. I was really interested in international conflict. Um, and so I went into the Peace Corps and sort of then expected to have a career in international development. I came back from Peace Corps, got my master's in public health, and joined a kind of a government contracting organization doing global public health. And so with that, I was managing programs primarily in Africa and Latin America. And I was most passionate about the work we were doing in Africa because we were working with in sort of post-conflict settings. So I was spent a lot of time in Liberia and then some time in what was then Southern Sudan, now is South Sudan, really working with governments, just facilitating, for more of the experts, trying to gather data to understand. I mean, these were contexts where health systems had just been completely decimated. Liberia had had a 36-year civil war, and there was really almost no health system. And so I really, really enjoyed working with governments and trying to kind of work with them to develop policies that aligned with their own priorities and what they kind of wanted for their future. And it was an amazing experience. But I learned through that I just didn't have all the skills that I felt like I needed to kind of do the best service in that position. And the big skill that I was missing is I didn't know enough about how to collect and assess data to make informed decisions. And so that prompted me to go back to get a PhD in research, to really hone my skills for, how do you figure out kind of what the problem is that you're trying to solve? How do you get the data together to solve that problem? What are the methods that you can use to, again, just generate really high quality findings that support decision making? And so that's always been sort of that having high quality data and findings to support decision making has always been a really kind of basic part of what I've wanted to do, which is, why now I'm really, really interested in policy research and health system research. I'm a very applied researcher. But the other thing that I kind of started to explore, both in, as part of this job, and then again in my dissertation, was the idea of family health. And so in Liberia, we were putting together basically a vision for how to support women and children, because the Liberian government felt that was their number one priority, was to kind of build a system to support basic maternal and child health. And then, I just fell in love with sort of the concept of this unit of a family, which, in my work now, we define in all sorts of ways. It's a chosen family often, right? It's not necessarily people that you're tied to by blood. But in my PhD program, I really followed up on that idea of family. And so a lot of my work focused on policies like family-friendly workplaces, policies that supported families to be able to live healthy lives. And so, after that, I was really determined that I wasn't going to do a postdoctoral fellowship, because who needs more training after you've gone through a 4-year PhD program with no income? But I ended up being connected with somebody at the Durham VA. I know she's a mentor of Erin's as well, Courtney Van Houften. And she did work in caregiving and work with older adults at the Durham VA. And I had actually come out to North Carolina to apply. I'd applied for a faculty position at Elon because I wanted to teach. And I was also really encouraged to meet with Courtney. I met with Courtney and I was like, this is the person I want to work with. So I gave up a faculty position at Elon to take a postdoctoral fellowship with Courtney. And it was definitely the best professional decision that I made. And my family was very supportive of that, even though we had sort of decided I wasn't going to do a postdoctoral fellowship. But then working with Courtney at the Durham VA, she actually directs the evaluation for the VA National Caregiver Support Program. I really loved the idea of kind of being in an environment where research was so applied, and the purpose of research was literally to support the priorities of sort of this integrated health system. So as you all probably know, that the VA is the largest integrated health system in the US. And that means that the incentives for keeping people well are aligned with how services are delivered. And while that's doesn't always happen in practice, that's sort of the idea. And I really believe that VA offers just excellent healthcare for veterans. They're also they're an innovation lab, and so it's, they have the National Caregiver Support Program that is the largest, most comprehensive supports for caregivers in the US. And Courtney was evaluating it. So I got to join her team. And again, sort of continue that passion of, generating high quality evidence to inform decision making for policymakers and service delivery implementers, and also continue work around caregivers. And so that's how I kind of got to where I am. When I transitioned from the postdoctoral fellowship, I joined Duke, their Department of Population Health Sciences. And so now I've got a joint appointment between the two places. And I should say, as of May 1st, I actually became the director of that evaluation program. So Courtney has stepped down after 10 years of amazing leadership. And thankfully, she's staying on as a senior advisor. But, it just, such an amazing kind of set of serendipitous circumstances, to kind of be able to do what I'm passionate about, and, also feel like I'm contributing to something. So.
Well, I just want to say congratulations. That's fantastic news. And yeah, I just learned a lot about you. So this is part of the reason I wanted to have you on, because I didn't know a lot of this, and it's really interesting to hear the path you took. And I guess one other question I have related to your caregiving research is, as you got into it, was there anything within your background? Well, two things. One, you said you came to North Carolina. So where were you before North Carolina?
So I got my PhD out in the University of Washington in Seattle. Okay. We're from the East Coast, but we wanted to check out the West Coast.
Okay. So you came back. Okay. Gotcha.
And my husband's family's all from North Carolina. So, it wasn't necessarily feeling like moving somewhere new.
That's nice. So then you said, I was just thinking about, a lot of, as you know, in some of the groups that we work on, but some of the caregiving groups with the work we're doing, it is interesting to find out as a lot of people bring caregiving experience or caregiving or something that happened in their life to inform why they're involved in caregiving, anything around caregiving. Is there anything that kind of aligned with you, that not only were you passionate about the data that you could, being able to gather data and look at evidence to inform policy and decision making, but any personal history that helped you really keep that passion for helping caregivers?
Yeah. So my mom has been a caregiver my whole life. She cared for multiple aunts and uncles. And now she's caring for my father. And so, I just remember as a middle schooler, we had multiple relatives living with us as they were sick. My, aunt, who was like a grandmother to me, passed from cancer, living with us, and her, and then my mom took care of her husband, who they had no children. She had a lot of aunts and uncles that had no children. So, just kind of watching her, and she was she was the sandwich caregiver. I mean, she was caregiving, she was working, and then she was raising 3 kids. My dad has terminal cancer now, but he also had a lot of health problems as a kid, when I was a kid. So she was really doing it all. And, it's funny, I think like a lot of caregivers, she didn't identify as a caregiver. It was just sort of what you do for your family and the people that you love. And so we didn't really identify her as a caregiver. And it wasn't until I got into caregiving research and started talking to people and hearing about caregiving experiences that it like really clicked. But I do feel like her example, even if I wasn't thinking about it in terms of caregiving, I was thinking about it in terms of what you do for the people in your life, and so I think that really sort of and again, just how every member of the family exerts sort of influence on the others. And if somebody's not well, it affects the others. And so that really kind of, piqued my interest in sort of these family-centered approaches to thinking about policies, systems, programs.
So that actually brings me to another question that as you were talking, I was thinking about how you were talking about Liberia and how they were looking at supporting women and children. And I thought, how forward thinking. And sometimes it doesn't feel like sometimes it doesn't feel like some of the policies that we have really think that way, or really at least those people going through some of these things don't feel like there is a lot of support. Is there what in your experiences with some of the things you learned in what you were doing over there, is there anything that you have found that you keep going back to when you think about some of those experiences, that either I guess I'm thinking either make you say, why can't we do something like that, or why can't we have more of that forward thinking? I'm just curious. I just would have never thought that would be a place that would be thinking like that.
I mean, I think our culture is very individualistic. And I think that there's other parts of the world where that's not necessarily the case. And the idea of your community, and your family it's just sort of part of the consciousness of how everyone operates. And, I do think that in the US, we've got a lot to learn from other cultures that have that approach. And so, yes, I mean, there's the family piece, but then there's also the community piece, and just, I feel like we don't necessarily feel how much our community influences our day to day, whereas that's just a given in so many other places. And I feel like, I don't know, I feel like our kind of policies and our systems would really benefit from that, because, health and the process of getting healthcare is not an individual endeavor for many people, and many people would benefit from support kind of around that process. So yeah, I agree.
And that's when I heard you say that, I was thinking, what a great vision and what a great thought to imagine community, family. And that's the bottom line. We talk about this in the caregiving space all the time. Caregiving's never going to get away from being a family issue. It's always going to be. The family is the first line of defense for everything, and should be. That's who does care the most. That's who is most passionate about what happens. Where we'd like to see more help is in the supports, in the anything we can do to surround those people in those communities, and especially underserved communities. That as you mentioned, when we're looking at healthcare, we've got to pay attention to that. So it's really great to hear that that those experiences help informed where you are. I do think I'd love to hear if you have anything new that you want to talk about, any new research you're doing, or anything that you'd like to share with the group, or just anything about your research is amazing. And I think I always get inspired when I see that you look at the caregivers. I think all of us who are here and have been or are caregivers, we just really appreciate the work you do in looking to help caregivers to support their loved ones. So anything new you want to talk about?
Yeah, I think I'd love to actually talk about a project that Erin and I are working on together with the Rosalind Carter Institute for Caregivers. I think I've mentioned that we're working with them, but one thing, so the Rosalind Carter Institute actually changed their name. They changed their name to focus on the caregiver and to center the caregiver. And so that's very much in their mission. And so we've worked with them for, over 5 years now. But the latest project is that they were really interested in trying to understand caregiver experiences, but in a way that's not based fully in the care recipient's diagnosis. Because so often we are cancer caregivers, we are dementia caregivers. But the truth is, there's actually, while they're very different experiences, there's actually some similar, like, an early somebody who's getting diagnosed for cancer and somebody who's getting diagnosed with dementia, there actually might be more similarities between those experiences than, early dementia, late dementia caregiving, right? And it doesn't center the caregiver. The caregiver is this sort of ancillary expected role, but it doesn't center the caregiver. So they wanted a framework that centered the caregiver and centered their voices and their experiences. And so we did a review of qualitative papers. We got 10,000. We have just had to redo the search and added another 2,000. So there's a lot of work out there, and distilled through that, kind of these essential caregiving experiences. And so we worked with RCI to develop what we're calling the profiles framework, where we identified 10 sort of different experiences of the caregiving experience that's not tied to the care recipient's diagnosis. And it's not tied to, well, contextual factors like community support, your age, your relationship with the caregiver or the care recipient are important. These profiles are purely the caregiver's experiences. And so we've got 10 profiles. We've just submitted a grant to try to develop a tool that can help sort caregivers into profiles and to sort of do some more validation of these. But this is something that RCI, the Rosalind Carter Institute, has taken, and they're hoping to kind of center their programming around these profiles just to make it even more caregiver centric. But it's interesting because I think one of the things I learned is that we still couldn't, every profile includes the care recipient in some way. So the caregiver is centered, but they're, managing a crisis with the care recipient, right? So there's still always that family or that dyadic unit, which I think is interesting. But that's the most recent kind of thing that RCI would like to infuse that into policy. They would like to have, so for the dementia guide, or the guide program, they'd like people to use that to evaluate based on where caregivers are, what's the training they need, so that's the sort of, I think there's potentially some broad implications. But as you all know, funding is really challenging, and so can we get the funds to kind of keep doing this work is sort of the next question. And we're working with RCI to try to do that.
That's excellent. And again, I guess I would say, let us know if there's anything that you think the coalition can do to support that work. Heather Altman wrote in the chat that her question was, how do the profiles affect the training? So that, that will be really interesting. And we hope that we hope to hear more about how your research can inform that. So I guess that's the last question is, anything that you would like to talk about, again, related to the Serious Illness Coalition, anything our group can be doing to support the work you're doing now?
Thank you. Yeah, I think kind of once we figure out what the next steps are with this, and RCI is also looking for funding, we'd potentially love to sort of share it and get your feedback. I love working with this group because, while my research on the VA side is very applied, sometimes as a researcher, you kind of feel like you're in the ivory tower, right? Like it's really hard to connect to policy, and we don't always have very good skills for how to engage with people, with policymakers, and with community members. We're trying to get better at working with community members, but there's a huge gap between policy and implementers and how we access them. And so, thoughts that you all have, particularly for this project, on how the framework could be used. Are there existing initiatives that, would find this interesting and potentially could adopt it to test it? Like those are sorts of things, like, just those real collaborations where we can merge the expertise of the coalition with like the good data that we've got to make life better for people, I just think is it's just this magical combination. So
that's wonderful. Thank you. And we'll keep that in mind as we go forward. And we'll of course be in touch with you with the caregiving groups that we're on. I'm going to ask you just a few questions. We're going to do a new thing with Friday Facts today. I asked Heather if it would be okay if I did what I'm calling rapid fire questions, because I always think these are fun when we get away from our work, professional life, and actually learn a little bit more about you as a person. So these are going to be easy. What's your favorite season?
spring.
I appreciate that, especially as a person who was transplanted from the Midwest to the South. It has become my favorite season. Any hidden talents or hobbies you'd be willing to tell us about?
So I don't know if it's hidden. I love mountain biking. It's something I picked up during the pandemic.
Really?
It's so fun. Yes. Yes.
Interesting.
Yeah.
So
Yeah.
now
So I
I'm
was like,
picturing you with a helmet on your head.
yep, helmet, glasses. My husband got me gloves. I'm all geared out.
Wonderful.
It's
Awesome.
so much fun because I'm a runner. But as I age, like my body can't handle the running I used to do. So mountain biking has become a
That's
favorite
great.
replacement. Yeah.
Another easy one, morning person or night owl, or
Morning
both?
person.
Morning person. Okay, and here's a little harder one. What historical figure would you most like to meet?
I'm fascinated with Queen Elizabeth the first. There's so much controversy about her, like who she was, like what she actually cared about. I would love to talk to her for half an hour and just learn what went on in her brain. So
Interesting. And last but not least, any favorite place that you've traveled to that you want, that if somebody said, if I just, I need a new place, where should I go?
So one thing I didn't mention, travel is a huge passion, and we've had the opportunity to travel to a bunch of different places, and I find I'm most drawn to the places that have really, really strong histories. So I think most recently we actually got to go to the Republic of Georgia because a good friend from college works there. And one thing I didn't know much about the country before going. There's so much history. I mean, there's churches from like the second century, like, and then Turkey, we were there about, I don't know, almost 15 years ago, has something similar. Because they're not super, they're pretty close to each other, but just sort of that historic, when you go places that you feel that history, I find that so fascinating. So
That's wonderful. Okay, with that, I'm going to end it. We can do more later at one of our caregiver groups. We'll ask more rapid fire questions, but I want to wrap it up by saying thank you very much to Megan Shepherd-Banigan. And then I also want to open it up to any questions anyone has. You can either put them in the chat or come off mute if you'd like to, just in the last few minutes we have here. Anyone have any other questions? Let's see.
I'll just say thank you so much,
Yeah.
Dr. Megan. It gave me lots of ideas on how we can do some exciting things with the coalition and partnering with you, and Dr. Kent is on. So this is inspiring.
Yeah, and I want to say on behalf of caregivers everywhere, thank you to you and Dr. Kent and everybody who's doing research on caregiving and caregivers specifically. That's where I just love the idea of caregiving research that centers the caregivers. So, all right.
thanks for the opportunity. It was lovely to talk with you all.